Rabies vaccination protocol for dogs and cats. Veterinarians, this is mainly handled by small animal veterinarians in practice. We vaccinate our dogs and cats at 12 to 16 weeks of age, and then we vaccinate again at 1 year of age. And after that, there's different rabies vaccines. Some are labeled for use annually, where you need to give a vaccine every year, and others are labeled for 3 years. So after they've had that first booster at 1 year, then they can be vaccinated at 4 years, 7 years going forward. You would wonder why you would use a 1 year vaccine when there's a 3-year vaccine. And one of the reasons for that is that in cats, there's been soft tissue sarcomas associated with some of the rabies vaccines potentially. So there's others that are built differently that they think are a little bit safer in preventing those soft tissue sarcomas. But whatever the label says is what the vaccine is covered for, whether it's a 1 or a 3 year. And so we have 3 classes of dogs and cats in BC in our guidelines. We have currently vaccinated, which means they're up to date. They've received a vaccine within the time period that that vaccine's labeled for. We have unvaccinated, which means they have no documented rabies vaccination. And in those cases, if they're exposed to a potentially rabid animal, such as a bat, we recommend that they're given a rabies vaccination immediately, ideally within 7 days of the exposure event. And the purpose for that is to stimulate protective immunity for both the immediate exposure and because then we're also adding a vaccinated animal to the population. And the reason we recommend that is because there's a little bit of evidence from places with a large amount of endemic rabies that if you vaccinate them right away, it might decrease the likelihood of the animal going on to develop clinical rabies. And also there's evidence that if we vaccinate them right away, if they're going to get rabies and die, they do that a little bit faster. So we have a shorter potential window for rabies exposure. Although with rabies, the incubation period is very long and variable, and we're never 100% confident in that. If they're unvaccinated and we can catch the bat, or the bat could be safely caught, it's submitted to Lethbridge for testing. And we recommend isolation and observation of the dog or cat. Vaccinated but out-of-date animal, again, administer a rabies vaccine. In this case, there's some evidence that shows that if a dog or cat's ever had a rabies vaccine and we booster them, they're likely to develop what we expect to be a protective immune response, even if they're fairly out of date on their last rabies vaccine. Although there's not super strong evidence that says how out of date they can be. Is it different for dogs and cats? Do other health concerns impact response? So there's some evidence, but it's not excellent evidence. And again, same thing, if they are going to get rabies, they're likely to die sooner if they've had a vaccine right away. And then again, test the suspect animal, and isolation and observation on a case-by-case basis. So this is where it gets a little bit tricky. We have to make some of these decisions about what we recommend. So here's case 1, the classic cat bat. And I tried to include cases from all the health authorities so Fraser Health doesn't get all the excitement. But this one is a VHA Fraser Health double case. So a lady was at a cabin in VHA, sleeping in her bed with her 2 cats, and she woke up to find a bat in her room that could not fly and might have been injured. She also noticed at that time a small wound on her face, which she hadn't noticed the night before. So the bat was euthanized. Luckily, this lady sold used books, so she had something by her bed that was handy, and she took matters into her own hands and euthanized the bat and placed it in the freezer. She didn't, when we asked her about the vaccination status on her cats, she couldn't remember if they'd been vaccinated. And her husband actually called us directly while she was on the ferry from VHA to Fraser Health Authority, and that was the first time that we made contact, or this lady made contact with public health. And luckily she'd packed the bat and brought it home with her. So we'll just spend a couple minutes talking about what would be appropriate management for this case, and then we'll go on to a couple other similar but slightly different cases. And then we'll talk, as a big group, we'll come back together to discuss all 3 of them. So I'll start the timer. So do we need to refer for medical health evaluation, and what is our recommendations for the animal health management? Maybe. How much time do I have altogether? Maybe 2 minutes, because I'm